Hello friends, are antiretroviral drugs creating problems? Is the title of this video. Friends, I am Dr. Vijay Hatankar. Though I am MD in Ayurvedic medicine, but I am always keenly interested in what is going on in the field of modern medicine, as it helps me practice my Ayurvedic medicine quite successfully. So, are antiretroviral drugs being used nowadays are creating problems? Friends, recently Israeli scientists claims on Phenofibrate, a drug of choice in the management of dyslipidemias. That means disturbances in the levels of lipids, cholesterol, triglycerides, HDL, LDL, VLDL, etc. Their ratios. So these scientists have claimed, they have published their paper, they have published their research on various websites. I came to know it through a website. They have used it in lab testing for COVID-19 virus, SARS-CoV-2 virus and Phenofibrate. This is their study. Friends, nowadays COVID-19 is a big pandemic going on all over the world since last 6 months, and its management is being done with some success, plus and minus. While I read this on this link, the Israeli scientist claims on Phenofibrate, I was surprised and as well as happy that a drug which doesn't have any direct action as an antiviral medicine, it will be helping COVID-19 management. So, what is they had given? This study has been conducted by Professor Yaakov Nehemias at Hebrew University in Israel. They found that an existing cholesterol drug, Phenofibrate, would downgrade COVID-19 fate level to that of a common cold. It's very nice to hear this, and let us hope that it helps. The findings allegedly come from a lab test on human lung tissue infected with SARS-CoV-2, the virus that causes COVID-19. What does the virus does to the human lungs? Virus infection causes the lung cells to start building up fat. The lung cells build up fat from the blood, obviously. And Phenofibrate allows the cells to burn that fat. The fat comes from the blood. So, fat in the blood builds up in the lung cells and lead to troubles. Thus, Phenofibrate will help to burn that fat. So there are many details given in this study. I wish everybody goes through this study. The researchers observed that the virus changes lipid metabolism in human lungs. They believe that halting this process could help prevent the onset of problems that increase the severity of the disease. So with this reading, I studied some antiretroviral drugs. As it is evident that the virus causes lung cells to start building up the fat, so the high blood levels of fat may support the virus mechanism, that they can lead to more virus load. They can help virus replication. So I studied few of the antiretroviral drugs in reference to this. What I found is that the presently useful drug is tocilizumab, which is being used. And I just thought of that, let me see the side effects and risk of this drug. There are some side effects and risk noted on many websites. I took details from a website. So there are few side effects, but surprisingly, there are serious side effects also after long-term use: high blood pressure, hypercholesterolemia, allergic reactions, which can include aching muscles, feeling out of breath, having a tight chest, wheezing, and high temperature. With this, I thought that I should bring this to the notice of the physicians, that there there a possibility that tocilizumab may lead to some aggravation of the condition. This is just a hypothesis. This is not any allegation or any inference. It is not a conclusion. It is just a hypothesis. But we should think of this possible link with the deposition of fat in lung cells. So hypercholesterolemia, it is an and dyslipidemia is seen with most antiretroviral drugs. So is it necessary to be very cautious while using these drugs? This is my humble request to please study the relation of these two. So this is quite evident that hypercholesterolemia, high blood pressure, and some allergic reaction may make the patient worse. Thank you.